I got time to read my word, and I got time to really focus on me.
To stop the pandemic, I would wear my mask and listen to what the law is telling me to do. I wear a mask, wash my hands every time I touch something. Definitely have everyone stay inside and maybe have people like deliver groceries to your house. Well, we wear masks, keep our hands sanitized, do it often even in the house. If you just wear a mask, it's not that hard. It's like a piece of cloth just over your mouth. But I just hope that it'll stop because I don't like people getting sick.
So what an amazing video. And here today we have Sharon Diggs-Jackson from Elite Skills Development. And Sharon, may you please tell us a little bit about your organization?
Yes, Elite Skills, it's a nonprofit organization located here in Long Beach. Our primary focus has been on youth and entrepreneurial skills. And when COVID came along, we kind of shifted our focus and just sort of jumped right in and trying to engage and trying to educate and provide information as it related to COVID. And as you can see from our young people, this was totally unscripted. We did this video with no pre-taping, no nothing. We just asked them to tell us what did they know about COVID and how it had impacted their lives. And so I think it's really important for all of us to understand that our children have been impacted. Their lives have changed and they're trying to adjust and understand what's going on as well. But I was also pleased to know and to see how educated they were and how serious they were taking it.
Yes, they were all very thoughtful and aware of everything that's going on in this time.
Yes.
Can you also provide us a little bit more about your health outreach and education efforts?
Sure. There were two components to our grant. One involved the videos. So in addition to the video that we did with the youth, we also produced 3 healthy cooking videos to where this is all Long Beach local talent. So there's 2 young ladies who put together 3 videos, one that talked about how to do a low salt Cajun seasoning, a low calorie ranch, and then they did recipes around jackfruit. So that's one series we did. And then we also had an opportunity to do a series with Black men. It was at a barbershop, and the men included a small business owner, a young man who owns a barbershop. Also another young man, John Atkinson, who actually lost his wife to the disease. So he talked about that. We had a doctor that answered a lot of the myths. And then we had a high school student who was able to talk about how his life had been impacted as well. So we did a series of videos, and then we were charged with producing a healthy living guide. And we didn't want to produce just a cookbook, but we produced the healthy living guide. The first section focuses on the virus, the vaccines, it gives the technical information. Then we move into talking about some of the underlying conditions. How do we just live a healthier lifestyle so that maybe we're not as impacted as severely by COVID? So it goes into that. We partnered with the Harvard School of Public Health for information, the city of Long Beach, Old Ways, which is sort of this back to cultural ways of cooking. So we talk a lot about soul food, how to make it a little healthier. The genesis of soul food, that originally it was pretty healthy way to eat. We've turned it into something else, but soul food at its roots is a very healthy way to eat. And then there's a great section towards the back of the book that deals with mental health resources, and that was put together by Be Well Collaborative. So we tried to go to the experts and put that information into one book. There's a section on walking, sleep habits, managing your stress. So the book is kind of comprehensive. It's a beautiful book. So if you don't have a copy, please reach out to us so we can make sure you have a copy.
Thank you so much for that overview of what you've been doing for the community, and I'm sure that they are benefiting from it.
Yes, thank you.
Next, we have Sullivan International, and today we will be speaking with Barbara Sullivan. How are you doing today, Barbara?
I am doing just fine, thank you. Excuse my dark glasses, but I had eye surgery on Monday. But I'm here and very excited about what we we're able to do for our outreach program.
Thank you. May you tell us a little bit about Sullivan International?
Sure. Sullivan International has been around over 35 years. I started when I was 12 years old. No, but we've been around Long Beach for a long, long time. And our model really is that of an ensemble model. A long time ago, I felt that the way to go was to be a virtual organization and to bring together experts in different areas, basically in the area of training and development, but also human resources, and most recently in our health communication. So that's been our model, is to bring the experts that's needed for the problem or the situation at hand and be able to give our clients customized, tailored solutions to their issues.
Thank you. And may you give us a brief overview of your health education and outreach efforts as well?
Okay, I see you are showing some of the information that we shared, and I'm going to ask Oscar Edwards, are you on? Oscar? Yes. Would you share our statistics with the group so that they can know what all of this resulted in?
Yeah, I think the main thing is we served an audience of 18 to 34 African Americans in Long Beach, city of Long Beach, targeting high propensity African American households in zip code 90806, 805, 807, 810, and 813 predominantly, with some spillover into some of the adjoining zip codes. Delivering as much impressions to those populations, really reaching 82% of the population in the target population, in addition to spilling over to some of the other age groups. Our targeting profile built on understanding the social engagement of that population. We used basically social media channels, which included Facebook, Instagram, and Snapchat, which all index high against African Americans 18 to 34. We also saw that in presenting the mix of short messages, that short form was more impactful than anything else against that demographic. Everything was 15 seconds or so. And that we target during the month of Black History and the following month up through April, but we tried to feature some of those themes to connect. We also found that from the science of viewership, that animation had an effect, a stronger effect in terms of recognition of the messaging. So that's pretty much our numbers. The core population was better than 30,000 in those areas. We had frequency up to almost 11 times in terms of first individuals who actually saw the ad. We had engagements of people who actually clicked through the ads, more than 25,000 click-throughs of engagement. So that means they actually engaged in the messaging and the follow-through. We collaborated with Ronnie's House and Speak Up Empowerment in terms of platforms, website platforms, as well as in terms of presenting some of their information to the target audience. So that's basically
Thank you both.
Our summary.
Perfect. Thank you.
You're welcome.
So moving on to our next organization, we have the G.R.E.E.N Foundation. And we will be speaking with Ernesta Wright. Can you tell us a little bit about your organization and briefly an overview of your health education and outreach efforts?
I will be glad to. Thank you very much, and thank you for the invitation. The G.R.E.E.N Foundation has been providing community education for 21 years to improve the health and well-being of African Americans and the underrepresented communities for health education, prevention, focus, and overall well-being. The G.R.E.E.N Foundation is an equity-focused organization, again, for the overall well-being of African Americans. And as we have shared and shown how data have shown for over 20 years of the inequities of healthcare and other social detriments in our communities, that the G.R.E.E.N Foundation has strategies and use evidence-based practices to be able to do outreach, community engagement, and navigation services. We have over 120 volunteers who are very involved and active, as well as a robust board of directors, and having over 60 years of combined experience from researchers, medical doctors, health professionals, or clinicians, or individuals who teach at learning institutions. We also have a program, a community-based organization of community health advocates, where it is a structured community organization of advocates who are needing and seeking service learning hours at a community or a college-based level, and that they are structured to a point where 20 hours of semester of on-hands experience in the Black community, and that we have a multi-ethnic group of individuals a part of that program. And so we're able to use their knowledge on social media to be able to help reach our target population in different and unique ways and using social media. We also provide and coordinate for over 11 years of comprehensive health workshops and conferences. We also share the importance of prevention and wellness through screenings, and also have a program where we talk about know your rights, know your benefits, to understand your health coverage. And definitely during this time of COVID, you need to know your benefits of how you're able to navigate the healthcare system to make sure you have quality healthcare. And then we've been a part of a lot of other initiatives. We often like to think of ourselves as an organization that can pivot to be able to bring strength to any campaign or initiative as it relates to engaging our African American community. We are very versed in the faith-based community as well as our community-based. We're very heavily involved in knowing that community is only at its best through collaborations, and our mission is, and it is engaged or embedded in our name, where it says gathering resources to educate and empower through networks. We know that we can't do it by ourselves, and that using relevancy of cultural relevance to our strategies have also increased our way of engaging our community. But I'm really happy to report, as the last gentleman in group had shared about the statistics and what we've done through this outreach effort, we were able to serve 215 individuals, and we had chosen mental health. And you'll see my colleague, Reverend Larry G.R.E.E.N, who is a clinician who was able to create the curriculum of providing mental health since January to March, where we did flexibility of hours during the day, during the afternoon, during evenings, during weekends, because we know that audience and our families have different types of working hours, and we wanted to make sure that we were mindful of that. The hours were, the mental health workshops were anywhere from an hour to 2 hours. They were engaging. The age group, believe it or not, who actually attended the workshops were between 18 and 49. We focused on making sure that people knew that it was a safe place to share, and that right now in the middle of COVID, we know that all of our mental health has been impacted, whether we recognize it or not. So we continue to create this space of talking about how is your mental health? So what I want anyone to take away from today and to share and continue the impact of what we did with this opportunity of collaborating is always asking your team members, asking your office, and we're upfront about it. How's your mental health today? And I want to quote, and I will end with this, that this 18-year-old young lady who's been attending the mental health workshops, she had coined this phrase, and I told her that I always would give her credit, and she is a young adult, and she's one of our community health advocates. She says, feel your flow and just be settled in it. So whatever you're feeling, feel your feelings and let it flow. So recognize where you are in a mental state and then do what you need to do to be able to improve your mental state. But it also makes the people that are around you aware where you are, and that we have found meetings have gotten much better because we are sharing and experiencing what we learn to talk about how's our mental health. Thank you.
Thank you, Ernesta. I love that quote. I like it.
Mhm.
Next, we're moving on to the African American Cultural Center, and we have Errol Parker here to speak for them.
Thank you very much, Victoria, for the introduction. The African American Cultural Center is about a couple years old, and our mission is to celebrate, cultivate, and advance Black African American culture here in the city of Long Beach and in the Southern California area. Our scope of work with the grant that we were awarded was to provide webinars and forums on various groups of people in the African American community. Webinars with women and with men and with young people and with church people. We covered a lot of ground in terms of these webinars. We've done 5 already. We have 2 more webinars to do. And the first one we did was in December. We was dispelling the myths of COVID-19. And we, to this date, we have over 500 people that saw that webinar and we've engaged with. There's a lot of myths out there in terms of COVID-19 and the history of African Americans in terms of us being oppressed. It has to be overcome. Some people are very apprehensive about getting the shots, and that's something we've engaged people about in our webinars. We came up with a very creative way to do outreach and education. We folded the vaccine clinics into a outreach and education forums. The first one we had was at Church 1 in North Long Beach, and we've educated 325 people who've received their vaccination shot. And while they were waiting, we educated them after they took their shot. So we came up with a pretty innovative activity in terms of folding those 2 activities together. The African American community is a trusted organization, and I think trust is very, very important when we talk about people actually taking the shots, because of the Tuskegee experiment and other things that we have been subject to in oppression of the African American community. That's one of the stumbling blocks that we have in terms of people actually getting vaccination. So we're providing a forum for people to give their views, whether pro and con. We're not trying to dictate to people. We are encouraging people to take their shots, but there are the feelings that we have to come to grips with in terms of the apprehension that Black people have with COVID-19. So we've provided 5 forums. We have a couple more coming up next month. Our organization seeks to be the center of the Black community in Long Beach, and a trusted center, so that when correct information comes out about COVID-19, how to cope, how to keep from transmitting the disease, we feel like a trusted voice in the African American community could be what AACCLB is doing. And so with that, we have educated almost 1,000 people already.
Thank you so much, Errol, for your overview on the African American Cultural Center and the work you've been doing. Next, we have the Clarissa Manuel Foundation, and here to speak on their behalf is Sheila LaFridge. Ms. LaFridge, how are you doing?
I am well. Thank you for having me this evening. Good evening, everyone. I'll just give a little overview about our organization real quick. The Clarissa Manuel Foundation is a public nonprofit institution focused on preventing the further deterioration of the community through educational and enrichment programs. The foundation was created by the Long Beach Alumni Chapter of Delta Sigma Theta Sorority Incorporated 10 years ago, and is named in honor of our dear soror, Clarissa Manuel, who dedicated her life to improving conditions for African American residents in Long Beach services, predominantly in the 6th district, and offered those services through the drug and alcohol rehabilitation treatment centers, infant health programs, AIDS awareness and preventive measures, and physical and mental health services within the community. Our mission today is to uplift urban communities by addressing educational, financial, and health disparities. And our vision is to build a solid foundation for the future, which mirrors the work of our beloved Clarissa Manuel. We have 4 program initiatives, which are educational awareness, financial independence, health disparities, and homelessness. We recently picked up because it has become a very large concern in the city of Long Beach. Our board of directors is made up of members of the Long Beach Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and also includes professionals and clergy from the community.
Thank you for that thorough overview, Ms. LaFridge.
Yes.
At this time, we will be moving into our question and answer session, and I do want to let the audience know that the chat is open at any time if you do have questions. So for all of our organizations here today, I'm going to start with what encouraged you to pursue this funding opportunity for health, education, and outreach specifically?
Do you want us to just jump in?
Yes, please. Anyone may speak.
Okay, well, I'll continue since I was speaking. We were brought this opportunity, and it kind of just aligned with the health education that we provide in the communities in the regular scope of work that we perform. And so we thought it would be a great opportunity to collaborate with a lot of other organizations and to also bring this further and closer to the community that we serve. And so in doing that, it gave us the opportunity to collaborate with a lot of the organizations that we've already heard from and some other organizations as well. And also to utilize the types of events we do virtual as well as, and we also went directly into the community after they lifted a lot of the guidelines, and so that we could touch the people. Our regular programming includes events such as going to vulnerable populations and bringing that information, such as trafficking. This is probably a population that not a lot of people thought about and or think about on a daily basis, but Long Beach does have a major trafficking issue, and that is young people, especially young ladies, who are pushed into prostitution for various reasons. When they're dealing in their economic situations and dealing with the unsavory people who are pushing them into these types of activities, there is no care for COVID-19, just like there's no care for their well-being. And so that was one of the populations that we wanted to target, and we wanted to bring that information to, as well as we do a regular event called Superwoman. And again, our women are predominant caregivers. They carry the weight of the world on their shoulders, and they're taking care of the home. Now they're in the home. They're trying to still be on the job, whether trying to figure out childcare or staying inside the home while they're working in the home. And so we typically do these types of activities on an annual basis. And we thought that this would be an excellent vehicle to bring them the COVID-19 information as well, to push prevention, safety, and now we are transitioning into vaccinations.
Thank you so much for sharing. Would anyone else like to answer that question?
Yes, I would. Thank you.
Perfect.
Sullivan International was very excited when we saw that for-profits was included in being able to respond and to get involved in the whole area of education and outreach. We have in the past always worked in the community. As a matter of fact, my husband says I'm running a nonprofit, but I always enjoy doing the work of the community. We have so many wonderful people and so many wonderful opportunities in Long Beach to work. And I could see that this was one where the collaborative of the companies that would respond, we would get a chance as a for-profit organization to work with the nonprofits in the area for a cause that, you know, we all needed to get out and educate and participate in. So when I saw the RFP and that it included nonprofits, I definitely for-profits, I definitely wanted to be a part of that effort that was going out to get this education and give this education to our community.
Thank you so much, Barbara. Maybe one more answer before we move on to the next question.
For our organization, I was excited at the opportunity to put together a printed guide. Part of my profession before retiring included media. So the opportunity to explore our health on a larger scale was exciting to us. And it was an opportunity to bring together a team. So our team consisted of members from the age of 17 all the way up to 70. So it was an opportunity to do kind of some cross-generational working together, and that was exciting to me.
Thank you. It sounds like this opportunity aligned with all of your what you've already been doing for the community, so you were just waiting for it. Thank you all for your answers. Our next question is, what are some strategies you use to ensure that your content was culturally relevant for the Black community?
Well, I'd like to jump in on that one. One of the strategies that we have, this is a traditional strategy, it's nothing new, but I have great relationships with about 35 African-American churches in the city of Long Beach. And through these pastors and these congregations, which are predominantly Black, we develop a strategy of reaching out and with a larger group of African Americans that go to church, where are mainly older people, but there are a few churches that have a lot of young people. So the strategy was, because of the personal relationships I've developed with these pastors, is to reach out through these pastors, these congregations, and the trusted pastors that are in those congregations to tell people they should consider taking a shot, consider getting this information. So it's not a new strategy, but it's a strategy that worked in the city of Long Beach. I've been around Long Beach a long time, so that was a strategy that we used.
Definitely utilizing your network. Sounds good.
Victoria, one other thing that I'll say, it was through our organization, we actually kicked off the city's mobile health vaccination clinic. And so when we started working with the city, we did the first one there. We said, if we're going to do it, we want it to be different. So we made it different. We had signage, we had music, we had balloons, we had pastors who were there to actually talk to them, to answer their questions. And the city was open to that. But you know, that was really important to us, that we needed to create an inviting space to welcome our people. And you know, sometimes we do things a little differently. I don't know if they've had too many other clinics that had the music and had all the atmosphere that we had, but we thought that that was an important component, especially to kick off the clinic.
Definitely, thank you.
And some of the strategies that we use as G.R.E.E.N Foundation, especially dealing with mental health, that is somewhat of a taboo, but we wanted to try to bring out the familiarity of talking about your thoughts or your feelings, and continue to talk about how safe of an environment this is, and how talking about your own mental health, that it frees others of talking about their own, and that we all have mental issues from time to time. So we tried to equalize it. So it wasn't about looking at someone else. We were all looking at each other at different times of our lives. So we tried to make it more familiar, as well as more of a conversation versus of just definitely comprehensive, but more conversation to keep talking about why it's important about your mental health. And then the other cultural part is that Sharon mentioned about music, that we incorporated old school, new school, and all type of music, from meditative to jazz to hip hop to you name it. And so that was able to, that cross-sectional that you also mentioned, we like to call it intergenerational. So we brought the young and the old constantly in this platform to let each other know how we could learn from one another historically, and how that was similar to our families, right? And family reunions, where we sit and listen to the elders. And so we had a little bit of that engagement, exchanging. And as one definitely point that came out of this is an 18-year-old sophomore a college student who one of the older gentlemen had mentioned about the word colored. Well, when it was the description of the word colored, he never knew that term. So he felt really engaged in knowing that now I understand. And even the word Black, why some older people rather not say Black versus African American. So we really got really nitty gritty in some of the other areas and being able to really open up our hearts more from a family perspective, because we are familiar, we are communal. And so that was what we constantly try to bring into these difficult spaces of talking about our health.
Yeah, making it
One
a
of
safe
the,
space.
yeah,
Oh, sorry, go ahead, Barbara.
I'm sorry. One of the things that we were very intentional about was the fact that we were at Black History Month. And so being able to have a campaign for Black History Month and to start we knew that people would be looking for information during Black History Month, and having that as a part of our strategy and putting our images in, and even putting the kente cloth in the first image. It takes a village. So what we were attempting to do and did do was to embrace the concept that we were in Black History Month, and to be able to get the contextual reference we wanted to what we were doing at the time.
Thank you, Barbara. Very strategic. And going back to the music, it sounded like some of y'all were hosting cookouts. But the next question I want to ask Sharon specifically of Elite Skills. So I know you developed the Healthy Resource Guide. So may you share how you ensured that that was culturally tailored, the content you incorporated in there?
Yeah, we started with the health department because obviously we wanted to make sure that the technical information and that the facts were there. So we worked with Dr. Davis, our health officer, and she scrutinized it and checked it out to make sure that the information was correct. But, you know, and then we started focusing on food. That's been a big part of the conversation, especially as it related to African Americans and the impact of COVID on them. So we wanted to be able to talk about food and nutrition, but at the same time, to sort of dispel some of the myths. So we spent a lot of time around that. But, you know, there's things that talk about immunity. Thinking about our health in a more global sense, we wanted it to educate. So while the coloring is amazing, it definitely has a flair, an African-American flair to it. We wanted to make sure, though, that we provided the best information and that we maybe gave our people something else to think about. There's a section on there that how you can have soul food, but how you can make it a little healthier. And then the section as it related to Black mental health. It's a great section that Be Well put together, but most of the providers are African American. And kind of back to what Ernesta was talking about, trying to dispel some of the myths, but let people know there are a lot of resources that are available to you. And that it's okay for us to reach out. So that's why we went to them and asked them to write that section for us.
Thank you so much. Excuse me. I do want to remind our audience that at any time, if you have any questions, you can just put that in the chat. We do have someone monitoring that as we move along. So moving into our next question, this is open to everyone. What was the hardest aspect about outreach and how did you overcome?
COVID makes outreach difficult. Let's just all be honest. We all had to think about different ways. How do we connect to our people? Errol mentioned the church. That avenue sort of has been closed off to us in many ways. So getting up to speed as an older person, getting up to speed on my technology skills was one of the things that I had to really focus on. But then thinking outside of the box, one of the places that we've taken the largest share of our healthy living guides and dropped off to are at 3 mortuaries. And we asked them to say, every family that comes in here, can you please put one of these guides in their hand?
That's pretty innovative, Sharon.
I mean, because we want to get to where people are suffering and wanting them to know that, because the book talks about a lot of things, but just trying to think outside of the box and what are our avenues. A lot of our sporting venues, we can't go to those and be able to distribute. So for me, I had to get my virtual skills had to be increased and then think outside the box. We committed to 4,000 guides. So we're in the process of distributing 4,000 of the healthy living guides. And virtually, there's a virtual edition of the guide as well.
Yeah, our virtual, as far as I am concerned, my virtual skills sorely were missing. And so I had to get with someone, Oscar Edwards, to make sure that what we wanted to do could be done. I knew in my head, but technically having the information, it was really great that there was information out there, like from Ronnie's house and some of the others who had videos already done, and we could take those and put them up. So that to me was one of the areas. We knew ours was a social media campaign, and I was really, really fortunate to have Oscar as my partner on this and to be able to get to the group that we wanted, which was the 18 to 34.
One of the things I wanted to say is that how I approach this, because it's so difficult. You know, the art of listening to one another is almost a lost art. Apprehension is a key word. Our people are apprehensive about health and vaccination. So therefore, you gotta listen with an open mind so you can develop a strategy. I'm a journalist by trade, and journalists are supposed to listen and be objective, put their opinion on the shelf. So we went on a listening tour of what is your apprehension about the shots? Those people didn't take the shot. And we listened, and so we said, well, okay, let's try to address that. And you've seen these other awardees, that's how they've gotten their strategies, is to listen, to be sympathetic and empathetic. We are Black people and we've been put down and oppressed. We understand that, but let's listen to our young people, listen to our old people. And I think you've come up with, particularly Sharon, what you come up with the mortuary thing. That is really, really innovative.
Right.
Can I give a shout out to Ernesta and her group? Repetition is important. And I appreciated your emails. You guys were diligent. You were on track. I was getting emails on a regular basis. And that's the way it is. I mean, the first couple of times I got them, I didn't read them. But because you guys had a schedule, you were on it. By the time, by probably that second week that you started sending out your emails, I was reading them. So you guys did a great job.
You really did.
You did.
Great, thank you guys.
One other thing I want to say real quick. You know, one thing I've discovered, I worked for the health department for a long time before I retired. The barbers and the hairstylists and the nail people, they are listeners. They are psychologists. I think all of us need to kind of get these people together, these small businesses together. They're the ones. Now, obviously, I don't do a hair thing because I'm bald. But Barbara, don't laugh at me too much.
Anyway. I'm really not laughing.
But we need to get these people together and say, hey, let's talk, share information with your customers on that. And I think that's something we should follow up on.
Let me share with you. That's what we participated with the community engagement. What the hard part was for us is that one-on-one contact. So what we charged all of our community health advocates, our interns and staff, we made phone calls. We called too. We introduced ourselves. We knew that they may not know who we are, and some of our community health advocates, because some of them were new of being indoctrinated in cold calling, because that's what you do. And some of them were saying, my feelings are hurt because they hung up on me. I said, I understand, but you have to understand them as well. This is COVID, that now they got another phone call that you don't want anything that they think. So don't take it personal. That our job is to constantly just getting the message out there. And so some of those organizations were the hair salons and barbershops. And that's a part of our engagement opportunity. And what I do is that we ask them, and you did a key word of listening. What we also do when we are able to find resources, we get resources that we don't need, but we get resources for our partners. So we collected masks just to send them to them. We collected sanitizer just to collect for our barber shops and our hair salons, and they really appreciated it because they couldn't get it for free. But we know that they provide a service, just like what Sharon is saying, that they provide a service, as well as, you know, as the wannabe psychologist and in the chair. So we do use them. And they are definitely a good resource, and so they're always a part of our strategy. For one, they're business owners, and I'm a business owner because a nonprofit, you guys, it's a corporation and it is a business, you know, bona fide, and that's a campaign that I will have to start another time. But people don't realize nonprofit is a corporation. We running a business, and so we have to be creative and thinking outside of the box. So we are working with hair salons, and that definitely is always a good opportunity to share and to listen to them. So thank you guys for both bringing that out, and thank you for giving us a shout out, because we just say we got to get on people's nerve, and we have a coined term. We say, I'll get on your nerves to save your life. So I'll get on your nerves.
Okay, I like that.
Victoria.
Yes.
Some of the groups that we hadn't talked a lot about this evening, we took a little bit of a different strategy. Our challenge was the metrics, and also getting the type of metrics that the city wanted from us. However, we know people are zoomed out, but there's a lot of population that don't even get on computers, and they're not even in that arena. So we took a team out onto the streets. We met the people, and as Errol and Ernesta said, people want to be heard, they want to be listened to, and they want to know that there are people who are out here who do care about them. They're not invisible. So we took a team out and we hit the streets to talk to them. We wanted to get not just that health education information out to our mainstream and our middle class and the people who have computers and will get on a Zoom and all of that, but we went out and we touched the women who were prostitutes. We touched homeless people, and we touched people who were out there in drug situations.
Wow.
And so and in doing that, we did utilize putting PPE in their hands along with the health information and a listening ear. That allowed them to have an opportunity for dialogue, to share their emotions and how they're feeling about it, while we provided the safety aspect of it, and then the information aspect of it, of resources.
Thank you all. It sounds like this was a learning experience for everyone. And we only have a few more minutes, but there was a question in the chat I do want to get out. This question was from Tobichi. Thank you. So how can people get the resources that your organizations have created?
I don't know if our websites will be posted, but
Websites.
To where we need to give our phone numbers or emails. I mean, I can put mine in the chat if you're interested in the Healthy
I think
Living
maybe
Guide.
Websites in the chat might be the best, so they can just click on it or copy paste that into their browser right now. So
Yes,
thank you all for being here. Go ahead, Sheila. Did you want to?
No, I was going to say our resource list is on the website, as well as we can put the flyer and information sheets we distributed up.
Perfect, thank you. So everyone in the audience, check the chats for emails and any other resources they will put. Thank you to everyone that was here today. It was lovely speaking with you all, and I hope you enjoy the rest of the evening.
Good job, Victoria.
Good job, Victoria, for sure.
Thank you. And thank you. I see all of the hand claps. You all are getting a lot of hand claps in the chat. Thank you. I can't thank you enough. Again, when we really conceptualize the RFPs throughout this process, we had a vision, and it's just been a wonderful thing, really seeing that vision really play out by the work that you're doing. We couldn't have picked anybody better. So again, I thank you. Thank you for being in this space. Thank you for giving your time. I know how much work that is. So we're going to go on to the next part of our town hall, which is a treat. So I had it up, but again, as you know, Oh, I think I see people leaving. It's not over yet. So, all right, let's get started with our second half. As soon as I. All right. Our next panel discussion is going to be about Black health equity, and particularly about Black men's health and Black men's health and COVID-19. Our moderator for this evening is Dr. George Smith. We are going to have Noemi help us to introduce our panel for this evening. So Noemi, I'll turn it over to you.
Thank you so much, Dr. Johnson. And hi, everyone. Thank you for being here with us today. So I will now introduce our moderator and each panelist for the Black Men's Health and COVID-19 panel. So today we have Dr. George Smith, who is our moderator for the panel discussion. We also have Reverend Swain Cofield, Mr. Iola, Mr. Ike Meje, Mr. Nevon Watson, Dr. Kayan Anderson, and Mr. John Parker. And now we'll learn a little bit more about each of our panel guests, starting with our moderator. So George R. Smith Jr. is an assistant professor within the Department of Public Health and a part-time faculty member with the Department of Health Science at Cal State University, Long Beach. Dr. Smith has a strong passion for addressing racial disparities in health and is vehement about increasing the number of underrepresented minorities in the health science professions. His research areas of interest include spirituality, religious beliefs, and their effect on health behaviors and health outcomes, ethical issues related to research involving African Americans, socio-cultural determinants of health, community-based participatory research, and psychosocial determinants of infant mortality and preterm labor among African Americans. So welcome, George R. Smith. Thank you for being here with us, Dr. Smith.
Thank you. So Naomi, correct? I want to make sure I get everybody's name correct. Thank you so much. And I think you're going to introduce the other panelists, is correct?
Yes, I will.
Great.
But thank you. Awesome. So now we have Reverend Swain Cofield, and he is a pastor of Rose and Sharon AME Church and family medicine physician at Kaiser Permanente, Bellflower and Downey Medical Centers. So Reverend Swain Cofield was born and raised in Kansas City, Missouri, and migrated to Southern California to attend college. He chose to become a doctor during his second year of college because it allows him to meet his personal goals of helping and teaching people, as well as to build relationships that last for years. Reverend Cofield graduated from Claremont McKenna College in Claremont, California in 1995, where he received his Bachelor of Arts in Science and Management with the chemistry track. He went on to attend the UCLA School of Medicine, where he completed his MD degree in 1999. He then completed his family medicine residency at Harbor UCLA Medical Center in Torrance, California in 2003. He currently works for Kaiser Permanente at the Downey Medical Center in the Department of Family Medicine. He is a provider that is knowledgeable and sensitive to the needs of members with intellectual and developmental disabilities. He has also been married for over 19 years to his lovely wife, Janine Cofield. Pastor and Mrs. Cofield have been blessed with two talented children, Kennedy and Timothy, and the newest addition, a cockapoo named Boomer. So Pastor Cofield loves learning and preaching and teaching the Word of God. He loves listening to good preaching. He also has a passion for educating men and women on health issues and empowering people to educate and share their medical knowledge and experiences with others. His primary goal is to help his patients set goals and understand why meeting their goals will improve their health. So welcome, Reverend Swain Cofield. Thank you for being here with us today.
Good evening, everybody. I'm very happy to be here.
Thank you. Next, we have Mr. Iola, who is currently a second-year student at Cal State University, Long Beach. Iola studies biomedical engineering under the honors program and is a McNair Scholar. Iola also serves as the Black Community Programs Director for the Black Student Union and oversees the AO's Advice Program for Black K-12 students. So welcome, Iola. right.
Thank you for having me.
Awesome. Next, we have Mr. Ike Meje. Ike Meje, a dynamic executive with robust hospital experience and a proven track record of success, is the Chief Operating Officer for Memorial Care's Long Beach Medical Center and Miller Children's and Women's Hospital in Long Beach. Following his administrative residency at Memorial Care a decade ago, Ike served in leadership roles at Sutter Health and Tenet Health Hospitals in California. Most recently, CEO at Doctors Hospital of Manteca and COO of Sierra Vista Regional Medical Center in San Luis Obispo. He was previously Administrative Director of Clinical and Research Services at Oakland's 819-bed Alta Bates Summit Medical Center. A Los Angeles native, Ike earned his bachelor's in public health and social welfare from University of California, Berkeley, and master's in health services administration from University of Michigan, an American College of Healthcare Executives fellow, and he and his wife, Renee, also have 4 children. So welcome and thank you for being here today, Mr. Ike Meje.
My pleasure. Thank you so much.
Thank you. Next, we have Mr. Navon Watson, Director of Student Life and Conduct at Long Beach City College. Navon has worked in the education arena for 11 years in New York City, New Orleans, and Los Angeles, where he gained experience in policy development, curriculum and instruction, and program development and sustainability. As a Director of Student Life and Conduct, he is passionate about advancing racial equity and diversity in the field of education, especially focused on Black male parents' success in higher education. He says, I am committed to developing trust and validating the voices of students by acknowledging good character and setting out of the classroom incentives for students involved in our program. In addition to the field of education, Navon is also involved in human services and nonprofit development. Outside of his position as Director of Student Life and Conduct, Navon enjoys surfing, riding his skateboard with his 6-year-old Kingston, and strategizing on way to expand access for Black male students. So thank you so much for being here today, Mr. Navon Watson.
Greetings and salutations. Thank you, Naomi, and welcome everybody.
Awesome. Next, we have Dr. G.R.E.E.N Anderson, who is the CEO of Always Progressing Incorporated and CSULB lecturer in the School of Social Work. As a young African-American, Dr. G.R.E.E.N Anderson encountered and overcame many hardships while seeking a better future for himself and his family. One of his biggest challenges was learning how to live and succeed with dyslexia and information processing disorder. Dyslexia made learning to read difficult, and it initially discouraged him from pursuing his dreams. Despite his learning challenges, he kept his head held high, overcame his own educational expectations, and inspired many others to do the same. Today, Dr. Anderson's work focuses on helping Long Beach's underserved populations, including those of first-generation, low-income, and ethnic minority students. In seeing the struggles of other students who come from backgrounds similar to his own, Dr. Anderson desires to provide support for local communities through nonprofit work, research, and mentorship. Dr. Anderson is also inspired to help students with disabilities in fighting stigma and serve as a model for student success. After achieving his Bachelor of Arts in Social Work from California State University, Long Beach, in 2012, he attained his Master's in Social Work in 2016. He also recently completed his Doctorate of Education in Educational Leadership program at the USC School of Rossi. It is a dream come true for G.R.E.E.N, who once thought of USC as an unattainable school. Since graduation from USC, Dr. Anderson has published 5 children/teen books and became the best-selling author. Moving from one accomplishment to the next, he aspires to empower and transform communities like his own through education. So thank you so much, Dr. Anderson, for being here today.
All right, thank you for having me.
Awesome. And last but not least, we have John Parker. John has been a Long Beach resident for 6 years, moving from the East Coast after returning from working in utilities for over 30 years. John's expertise is in customer service and collection. He is an accomplished musician and served as minister of music in 2 different churches and has played for too many to remember. John is a licensed and ordained reverend who has served as youth pastor and mentor for hundreds of youth. John is the director of Parker Family Homes, a state-licensed foster care program, and president of the AP Foundation, a community-based social services organization providing an array of programs to create healthier, stronger, and more connected families and communities with equal access to resources and services. So thank you so much for being here, John Parker.
I am honored to be on this panel with all these great people.
Awesome, thank you so much. And now I will pass it over to our moderator, Dr. George Smith, so you can take it away.
Well, good evening, everyone. This is really going to be great. When I saw the gentleman who will be participating, I learned a little more. We got a reverend and a musician. So it looks like the reverend may preach and the musician may bag him up, but that's part of the Black church experience. So we won't go there because it's non-sectarian. But I was told by Dr. Johnson that she didn't want this to be stoic. She wanted us to have like a conversation and talk about health. I would say talk about being in a barbershop, but as we learned earlier, some of us haven't been to barbershops in decades, so not all Black men go to barbershops. So I'm just saying, some of us do it at home, some of us go to locticians. So we're just gonna have a good conversation today, okay? And so if I call you by your first name, don't take it personal, but you know, we are a kindred spirit. I may say brother, but you know, we all are. So we'll go ahead and get started. So I'll have the first question. I'll put this out there, anyone can choose. And one other thing too, I did notice, because I'm in public health and I assess everything, we got at least 3 generations here. We got Gen Z, we got Millennial, and we got Gen X. So I'm Gen X, so I don't think we got any baby boomers yet, but we'll work on that on the next one. So here we go. Here's the first question, and anybody can join in. Go ahead. What does health and well-being mean to you?
I'll go, George, since
okay, thank you.
I'm probably the oldest person here, but Black don't crack. It means to stay physically active, eating healthy, and allowing your body to rest, despite the busyness of life. Health and well-being, also surrounding yourself with the right people, and putting yourself in the right environment to be able to maintain stable mental capacity and to be happy.
That's a great response. And I'm glad, John, you said that about mental capacity. And, you know, unfortunately, sometimes within the African-American community, particularly among us African-American males, and remember, everybody else is just listening to our conversation. So when I use that, it's kind of inclusive, but it's kind of exclusive too. So within, it's all of us. So let's all get comfortable. But, you know, sometimes we, and I mean we African-American men, we kind of don't want to talk about mental health because we think we got it together. You know, if we say that we have some mental issues going on, something wrong with us, we're weak, how do you think we can combat that? What do you think are some of those challenges that are happening within the African-American male population in regards to our mental health? We know mental health ties into our physical health and can lead to unhealthy behavior. So what do you think about that? What can we do? How should we address it? Do you think it's an issue?
If I may go, just because this is something that I was actually having a conversation with earlier today. So I think that we do address it as Black men. And I think we do it in a way that's unique to us, which is exactly what this conversation is, right? Like, I do think that we ask for help. I do think that we reach out. I do think that we all know, you know when your homie isn't right, you know when you're not right. And I think that looks a certain way. But what I do also think is that people don't know how to receive that. You know what I mean? Like, I don't think that it's like perfect example. I think that it's always something where, you know, as Black men, just with the stresses of being a Black man, right? You're navigating through society, you're navigating through America, you're just navigating through. And I think those moments when we get so defeated and we just stop, right? That's when stereotypes and assumptions, but that stop isn't something that I think a lot of us realize we're doing on our own. Sometimes it's chemical. Sometimes it's like your body's saying no more. We're done. We've had enough. We're broken down. And when that occurs, then it looks like maybe we're stagnant, right? And everyone is like, oh, remember the old days? Because I sit back and I think about a lot of I'm from New York, if you haven't seen. So I think about a lot of the old heads, or the older heads than myself, because I ain't young. I just got a cut. Trust me, Olis is white.
Beijing does wonders, I've been told. That's what they tell me.
Nah, this ain't no Beijing. This all real. But I think about some of the older brothers that I know and seeing what them being stagnant looks like, but they're also digging deeper and realizing that there was something that happened that caused them to become stagnant. There was something that took place that caused them to be in this state where they're not themselves. And I'm noticing that more and more as I'm working, especially with the young men in the college. And I'm saying like, yo, I think you need to go talk to somebody, and not like for real, like this is not, I'm not joking. I'm not saying it like as a Def Comedy Jam humor. I'm saying this like, I can't help you. What I'm hearing is really more, you need some help. And them actually taking that and receiving that and being like, you know what, I do need that. But nobody has ever said that. They said I was lazy. I need to just work hard and grind it out, thug it out. It's like, that's gonna, like Cornel West said it best. If I'm always awake, I'm in a state of like frenzy. You gotta rest. So, and I think like that's my take on it. So as I hate these conversations, especially about Black men, I'm like, we're human. Of course we need help. You know what I mean? Like, of course we show it, but it's how is that received?
Anyone else? Feel free. Come on. It's our little conversation. Go ahead.
I think just sort of adding to that, when I thought about the first question, what came to me is sort of like the feeling of safety. So like, I need to feel safe physically. I need to feel safe emotionally. I need to feel safe mentally. And I think that when we think about asking for help and what that looks like, and oftentimes the systems that are available, they don't speak to us. When I personally went to get a therapist, I was very direct. I would like to speak to somebody who can relate to my experiences, because some of the things that I'm experiencing, if I get the wrong therapist, they gonna be slightly judgy about some of the thoughts and feelings and the emotions that I have. And when I was assigned a therapist, it was the exact opposite of what I very deliberately asked for. So I think that sometimes when we think about accessing space and what that looks like, it's centered around safety, and it's done in a way for, I think for, at least in my experience, we get comfortable being unsafe. So we're in environments where we're probed to appear a certain way, to speak a certain way, to not be innately and have conversations how we're having right now. And then we're told, we want you to do it this way. And I think that back to sort of the gentleman who spoke before me point, we ask for help, but are people really listening when we're asking?
And any other thoughts about that? Again, it's our conversation, so we can say what we want to say.
I agree with all the sentiments that have been expressed. I think it's about continuing to normalize the conversation too. So I think as much as we have our unique way of expressing that need and that desire for help, I think it's also really important that we have these conversations with our loved ones and other brothers and let them know how we're going about seeking support, because so much of our experience, at least my experience, is based upon the connection to others. And I think this past year has been a year unlike any other, where it's been easy to stay disconnected and isolated. But I think it's really important that we find that connection in our loved ones, other brothers, support groups, fraternities, family, whatever it is, and have those conversations. And I think that that's really key for us.
Yeah, I'd like to add something, and I'm only going to add this because he just mentioned about this being a year like no other. I mean, being the best version of ourselves is really what we strive to be, and we can't do that without having support, without being supportive, and without having personal goals. I've been fortunate enough, my father was a basketball coach, my mom was a principal, so there was always this 1 year and 5 year plan. I'm like, I'm only 7 years old, what am I thinking about a 5 year plan? But I transitioned that when I got to college, I transitioned that when I got to med school, and I transitioned that when I got married, and here I am almost 50 years old, and I still am, and it allows me to set personal goals, it allows me to engage with my church members, engage with my patients, and if we can help each other meet goals, because we've been talking about networking since 6 a.m. I've heard nothing but networking, and everything is about access. Like Dr. Anderson's talking about, you know, that the therapy, people are sometimes seeing other people and they're just checking boxes and not meeting our needs. And we need to be able to meet each other's needs, and sometimes it begins with a conversation, and that's why we're here.
Any other thoughts on that?
All right, after letting all the elders speak, I'm going to give a little young perspective.
So you're gonna go ahead and what you call it, drip? You're gonna drop it on us? What is it called?
Exactly.
What is it called?
Reclaim that.
I get
Exactly.
drip and drop confused. They're two different things. So you getting ready to drop it, right?
Yeah, I'm gonna give a little young perspective on,
all right,
the
go
first
ahead and
question,
flow.
right?
I'm just trying to get those terms. Okay.
All right. So what health and well-being means to me, right? It means the upkeeping of positive social, economic, mental, emotional, spiritual, and physical status. And when I say all of these things and all of these terms, I don't mean being the smartest person out there, being the strongest person out there, right? Being the richest when it comes to economics. It's more so upkeeping yourself to a good standard in each of these categories, right? From a social aspect, in order to have a healthy social status, you should still be interacting with your friends, interacting with your family in healthy ways, maintaining good and healthy relationships, right? We are social beings, we are social creatures, and therefore we need to upkeep good and healthy social relationships. On the economic status, we need enough money, we need enough resources in order to upkeep our lives, in order to upkeep our families, and in order to upkeep basically the rest of those things too, right? Without a good economic status, a lot of those other things just basically fall apart. Mental status too, right? We need to have good thoughts. We need to have good mental health, as we've talked about before. Emotional, spiritual, those kind of like tie together. Get in tune with God, get in tune with whatever faith you believe in, right? And get in tune with your emotions too. Learn how to express them, right? Because once you bottle it all up, once you lack that knowledge of how to express those emotions, everything else falls apart too, right? And the physical status too, exercise, diet, all of basically what your doctor would tell you, right? In order to live a good and healthy life, long, good and healthy life, keep your physical status too. So in each of those categories, you need to keep a positive status, right?
All right. Well, thank you for that. So any other comments before I go to the next question? This is good. This is a good conversation. I really am enjoying myself. Have you noticed the young brother, and I can say the young brother, he even rhymed when he was talking. Did you notice that? I was looking at the tablet. He was like, bam, 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 bam. Boy, you gonna be a rapper too? Make you some money, because I think you should come into public. You should come into public health. Talk with me when this is over. I got a plan for you. Public health. I like public health. Okay. All right. Other people may want to indoctrinate you, but let's kind of work on public health. So my next question I have is that given some societal factors such as racism, and it could be colonialism, we know, education, access to healthcare, and employment, and how do they influence health outcomes? I mean, what efforts do you think we need to do in those realms, whether it be economic, it can be social? How can we improve Black men's health? I did a little research before I got here. They said a little learning can be dangerous. And so I was like, I want to know, what is the average age how long is a Black male going to live in the United States? So it did go up. So I was happy. So, I was good. So those who do the little reactions, give me the, the signs up emoji. So I appreciate that. But according to the National Vital Statistics of 2018, African-American males have a life expectancy of 71.3 years. It did go up. We don't have the highest, but it did go up. So look, everybody's like, yeah, it went up. However, what can we do? Or what can you do? What can society do? What can we do? And we can be inclusive to the African-American community, and it can be exclusive. What can we do? I know that was deep, but
I think it's a great question. And I think it's multifaceted too. I think it's a variety of things. I think it's conversations like these that start with us really taking more responsibility at the individual level, improving our health knowledge and education and our literacy. I think taking more responsibility for our health in all the different ways that the brothers have described, as well as taking responsibility for our own outcomes. And so at an individual level, I think it's about, how do I stay healthy? How do I maintain a good a lifestyle? How do I promote a good nutrition or stay active? How do I know my own family history with health? And what does that mean for me? What do I need to do differently? What conversations do I need to be having with my doctor, as an example? So there's the individual level. I think there's a community level of really looking at within our communities about what increasingly is being called the social determinants of health. How well do we have some access to transportation, to good education, to economic empowerment, to, the list goes on, but I think it's working with organizations in the community, working with the church. You talked about the Black church has a huge role in how we can promote health amongst Black men and the Black community at the community level. And then I think lastly, I think it's about how do we continue to affect and promote change at the systemic level? So how do we go about driving training around implicit bias and racial bias and cultural competent care? And like Brother Keon talked about, having people speak to you from a culturally competent standpoint where they're acknowledging your experiences and truly engaged in that, and having more providers who look like us and have our experiences. And being able at a systemic level to look at access. Why aren't our communities having the same levels of access as others? And so I just look at it, it's multifaceted, it's not one single thing. I think it's at individual level, community level, and the system level as well.
Yeah, I definitely agree with Ike. And, I think having a positive health message like this thing we're doing tonight, this is how we reach our people. And I also think you kind of hit on it where I think our healthcare providers, I think, should have a lot to say. And I think we should drive them to start making changes because it's lopsided for people of color, and things need to be turned around from the top to the bottom. So it's definitely a systemic issue. And I agree with you. I just wanted to say that a little bit.
I wanted to talk about resources because it's really part of the system. And since we've already talked about the term access, which is one of my, culturally responsive care, those are big things. I'm the only Black man in a hallway of 14 doctors, and I always get asked, where's everybody else? And I'm looking for people that, recruiting, but ultimately, the way we break barriers, like for example, the way we break a barrier with Black lives and Black Lives Matters is we don't need other Black people to care about Black people. We need people outside of Black people to engage with us and understand. And the same thing applies to this. So, so now if you look at like CEOs of corporations and Fortune 500 companies who might give grants for Black communities for health projects, those people they're not very many Black people running those companies. So at some point we need to engage, we've been saying for I'd love to say 5 or 10 years, but for decades. I remember this discussion back when Reagan and Clinton were president. And, we've been trying to make a community, we've been trying to break the barriers of the Tuskegee experiment way back then. And here we are fighting the same fight, just more people know about it. And that's more probably because of Google than anything else, but people still know about it, and they can find the right information. But we've got to be able to, we use each other, we use Black folks, but we have to be able to combine resources. Right? We have Black church communities that engage with Jewish communities in downtown LA and Baptist, all over. It's a multi-denominational, and that applies to people of faith. It also applies to health as well.
I think that sort of my tidbit, and as I think of this, I agree with much of all of what you said. I do think that addressing this is multifaceted. I am a practitioner of shifting away from equality and shifting to equity. The conversation is not fairness. The conversation is doing what needs to be done. When we think about from an economic standpoint, or the ability to be able to just maneuver in everyday life, all of those things impact our health. If I go outside and I walk my dog at the wrong hour and I'm having a panic attack because the police pull up, like all of those things ultimately impact our health. And I think that we have to be able to talk about an equity standpoint. We have to be able to work in environments where people truly appreciate us as Black men as human. Because more often than not, people are fanning for PETA, not that I have a problem with animals, but people were fanning for PETA, but then when it comes to Black men, we're not seen as human. And it's like, at some point, you know, we have to shift. Like, I don't want the same thing as you. I want what I merited. I don't want to work twice as hard for mediocre results because you feel like I need to do more in order to be where you were and you weren't qualified for your seat. So we have to sort of make sure that we're working towards equity and we're really approaching it from multi-tiers. When I work with my kids, I'm like, the world isn't fair. So the world isn't fair. And unfortunately, I'm still gonna tell you, you're gonna have to outwork everybody in the room. And then when I'm in spaces where people are able to actually make systematic change, I'm having honest and real conversations, despite the fact that I might get fired. Because sometimes people don't want to hear the truth, or they're offended, or they're uncomfortable. And we have to be able to have these conversations. Otherwise, we're making small incremental changes towards humanity. I'm making a small step so that you can feel like I deserve to breathe.
Hey, I'm sorry.
Go ahead. Oh yeah, you can jump in. Go ahead, Rev.
I'm not the moderator here. I'm not the moderator here, but I got a question for these brothers. How or what decade of your life did you realize you had to work harder? You know, was it your 30s? Was it your 20s? I mean, when did you realize?
First decade.
Right now.
The first decade.
Reverend, you know all, I'm gonna use this, I'm using African-American vernacular, so forgive me. Yeah. You know all of us is Black. Yeah. So, but I'm joking, but I hear what you're saying.
But in all fairness, what I'm thinking is, you know, depending upon where you went to grammar school, where you went to high school, if you were, you know, not in a blended community, maybe it was college, maybe it was your first job, maybe it was your second career, and you know, it varies for all of us until we finally get in the same room and we realize, gosh, you know what, the struggle is real. And you know, how many people y'all walk into a conference room and the first, you want to find out, where the other Black men are, if there are any, and you get that little head nod and you want to find out. I want to find out what department they're from. I know 7 Black men, orthopedics, nephrologists, whatever, and I can tell you the day, the month, and the location where I met them.
It's real. I appreciate that question. I think so much, the struggle is real, and I think so many of us had that realization instilled in us early that we had to be about our business and work extra hard. And I think for me, that was in part shaped by my family experience. I'm the son of immigrants who came from Nigeria, and they came here with no other option, but we're going to succeed. And so from a very early age, it's about how are you going to be about your business? And but again, our struggle is very real, but there's great diversity in our struggle as well. So I'm curious to hear from other brothers as well. So thank you for introducing that.
Yeah, I realized I was like 9 years old. I'll never forget. Like in New York City, they rank us, all public schools, they rank you. And in the 3rd grade, I got ranked #1 in my school district, predominantly Black district. I got #1, which actually meant that I was able to be promoted 2 grades ahead by advice of the district, because I was from a single parent household. They didn't think I would adjust well progressing forward. And at that moment is when I lost all faith in education. I was like, no matter how hard I try, no matter what I do, it's always going to be somebody that's going to be somewhere that's going to say to me, you know what, you're still just not good enough. Even after outranking hundreds of kids, like #1, like literally still to the day, I look at that paper and I'm like, you gotta let this go, but damn, you rank #1, bro. Like, so that's the first part. And then I want to kind of follow up what Dr. Anderson said about some of the so for me, I'm not, and I'm happy that y'all all shared what y'all shared, but to a certain part of what y'all said, I guess where I'm struggling at is that I think that there needs to be systemic change. Like I think I think at this point, the expectation of the community and the ground and the families, we've done a lot of that groundwork from where we were initially as a community. I think from the 50s when we had a common collective consciousness to where we went through during the 80s, during the war on Black people, war on drugs. Then we can continue on throughout where we've continuously rebuilt. I think just as a people in this nation, we've done that. California has the worst like incarceration rate for Black men, right? Even from that, continue to rebuild nationwide, just the death, right? So I think as a people, we do a lot of one of the prongs that Ike was mentioning. We do that. We do work on the community. We do rebuild. But I think there needs to be, and this is me and my personal opinion, there has to be some affirmation, some policy from the governments, from the governors. Like there's something that's etched in stone where I identify as Black. Like this is a state of emergency. Like I just identified like basic, like if you go back to the war on drugs, and you just like think about that. Now you have people that are getting like licenses to sell marijuana, and Black men and Black families have been devastated by this, like devastated. Like some of us here may be systems impacted family members, but then we sit back and then we say, well, how do we, well, what can we do? Can we just say, you know, keep going? No, it's not keep going. There's no possible way you can go up against a system without having something from the system. We need a policy, we need a sword, we need something that says Black men, like I love what the Black women are doing with the Black maternal health. Like I think that because even in that's fighting for Black men, because those Black babies, those Black boys that aren't being born because the healthcare system is not cultivating them, that's our future engineers, that's our future scientists, that's our future doctors. You know, granted, there may be some future other colorful characters, but nonetheless, they belong to us and they deserve to be here. You know what I mean? So for me, I'm at that point in my life where there's been a lot of education, there's been a lot of grace, there's been a lot of forgiveness, but I need action. Because as I'm raising my kids, they can't grow up in this same world. They can't, and there's not change happening because the policy isn't following it. Like there's nothing that's saying we are human. There's more consideration to conflicts in other worlds than there are in conflict, literally in other worlds. And I'm not saying that those conflicts in other spaces and other parts of the world aren't important, but I'm saying the reality is right now, I know students that are Black male students that have dropped out of high school right now, right here in America, but the focus could be on the canal, right? On the Suez Canal, and it was stuck. And it's like, yo, how, you know what I mean? We're never a priority. We're never at the point of conversation with policy. It's very performative. It's like, give them a couple bones, give them a couple peanuts, let them dance, make them happy. We throw a couple million there, but where's the law to follow that when those politicians that don't have an interest in this come into office, when those elected officials, when those CEOs and those Fortune 500 companies are not interested in the Black agenda and not interested in this conversation? Where's the policy that supports that? And all we're gonna be left with is hugging each other, and that's not enough, in my opinion.
Yeah, Nevin, man, you hitting it right on, dude. Like I said, I'm a little bit older, and I remember time. I got hired by a utility company, and entry level. I got inside, and they asked me, "What job are you trying to go for?" And I said, "I want to be your boss." Guy laughed at me. He said, "That's not going to happen." That was in the 80s, all right. But by the time I retired at an early age, I was eventually not that guy's boss, but his boss too. Teach your children who they are, and regardless of how society looks at them, you're absolutely right. It needs to be a change, and I think where we are now in America, I think we're headed towards that. And I hope in my lifetime, I see us as Black folks get our equity. We got to do this. We got to teach our kids to keep pushing, to be the best, because, you know, I grew up on the East Coast, and I lived in a city called Camden, New Jersey. I'm sure probably half of you heard of Camden. Camden is rough, right? And it's a poor city. And I was lucky enough to get a job. You know, I was lucky enough to get a job, and but a lot of people who didn't get a job that I know, you know, suffer from not having the medical, you know, getting all that insurance and all that stuff, and being able to get a 401 plan and saving money. They struggle. And of course, you know, if you don't get that medical care, you're not taking care of your body because you just don't have insurance. You don't have money. You don't have money to eat, let alone try to get insurance, you know. So we have to make some changes, and it starts with us teaching our kids to keep pushing and get in there, get in with them, and make America change, because this is ridiculous and it's hurtful. I mean, it's almost like watching Roots. I don't know if you saw Roots. When I was young, I watched Roots as a kid, and it made me want to cry. I'm like, and I don't see nothing's really changed. So we got to make this work. You know, I'm getting upset now. So let me shut up.
No, going back to go ahead.
No, go ahead, brother. You got the
Okay. Going back to what Dr. Kofi was his question, right, about, and we realized we had to start working more. Originally, I said like this decade right now, right? I'm 19 years old right now, and I said this decade. But then after, a little bit of self-reflection, and after hearing all your answers, and you said the first decade, I was like, it is actually the first decade, because I remember when I was a kid, right? I've always had these goals in mind, right? Ever since I was a kid, I've always wanted to enter the medical field. And a little bit of background about my health, right? I deal with sickle cell anemia and asthma. So I've always known from the jump that even despite, being Black, and on top of that, having these medical conditions, I'm going to have to work even harder to get what I want to get and get to where I want to be, right? And where I want to be is into the medical field. And a little bit more insight of where I want to get to is I want to go to medical school. I want to become a pediatric cardiothoracic surgeon. Now, that may change once I get to medical school. It may not change. But as of right now, that's where my goal and where my sights are set. And as I've entered this decade, and as I'm now leaving this decade pretty soon, right, I've realized more and more how much harder I have to work, right? After educating myself, after still learning more and more, and seeing how society works, seeing how all of this oppression is happening in the midst of our eyes, how it's going over a lot of people's heads, a lot of the ignorance, a lot of the miseducation, a lot of, the re-education, the relearning that we all have to do. I'm realizing how much harder I have to work, how much harder I have to work with others, how much more I have to collaborate, how much more I have to communicate, and so on and so forth.
Okay. Those are good. And I'm glad that leads into another question that I have, because we have to talk about the virus. And we have to talk about the fact, and I just have this question. It appears as though, and again, we have to be careful when we talk about the data, but it appears as though we, in our little group, because it's our little conversation, don't want to get the vaccine. Why do you think we, in our little conversation, don't want to get the vaccine?
I would like to start off with this one real quick.
Go ahead.
Okay, so I've had a lot of conversations with my peers, like people around my age, and it all really ties back. A lot of it ties back to education and miseducation and assumptions and whatnot. Like, there's a lot of conspiracy theories going around. A lot of information that people are relying on is not necessarily reliable. Now, I can understand why they are taking in this information because of the history of what has happened to us as Black people. At the same time, a lot of it is really just missing information and conspiracy, right? When I talk to a lot of these people saying certain things about viruses, DNA, and how it may work, how it may affect our bodies, and whatever the agenda, what the goal of giving Black people this vaccine is, right? It goes back to a lack of understanding about how, medicine works, how vaccines work, how pandemics work, right? And how distribution works. So a lot of it is just conspiracy. A lot of it is miseducation. A lot of it is relearning a lot of things that we have learned early on in our lives, and knowing how to find reliable information, knowing how to dictate what is bad and false information versus what is true and good information. But yeah, like a lot of the conversations I've been having with my peers lately has been, yo, this vaccine is gonna do this to our DNA, and it's gonna turn us into butterflies or turn us into mental slaves. And I'm just like, relax. It's not going to do all that. It's really not that big of a deal. You got to calm down and reflect and realize and learn how these things actually work.
I'll add because I don't think he's 19, by the way. You got much more knowledge than your 19 brain. But this has also been a lesson in statistics. You know, people have to understand the yellow tier versus the red tier versus the purple tier, and cases per 100,000. And if our government leaders don't understand the stats, then, you know, how, and these are the same people that are promoting the virus. These are the people that are in the front that are promoting. That's why it really takes us. But the history is really the primary thing. And I'm going to pause and because I'm sure there's other opinions. But if you think back, and you know, one of the biggest historical things that I remember reading about, even before I was taught, was about the Red Tail Squadron in the 1940s in World War II. And you think these fellas came from Tuskegee, Alabama, and they got these medals of freedom and all this stuff, and they went back to the same city that was supposed to do a 6-month experiment, actually a 6-month providing healthcare that turned into 40 years, and they left people untreated with syphilis. And, you know, they left people untreated, and they were, and everyone thought they were getting care, they care about us. And so they came back to this segregated society. So, and, you know, we talk about the Great Migration, people migrated from that area. So now that mistreatment spreads all over the nation. And, you know, we sit around playing dominoes, playing cards, and visiting our grandparents. And this is all we talk about, you know, and so that's where misinformation begins to spread. But there is a fact that the Tuskegee experiment happened. It wasn't a 2-year program. It wasn't a 10-year program, 1942 to 1972.
Well, yeah. You know, I've talked to several people about this, and I've actually had some friends who had it, and I've actually had some friends who passed away from it. I kind of blame this on misinformation. I blame this on the last administration. I blame the divisiveness of this country in all regards, especially in this situation. It's unique to us because I don't think any of us here are 100 years old and seen the 1918 pandemic. So this is new. We don't believe, we haven't believed much of what we've seen. And I can understand how a lot of us as people of color can say, yeah, you believe them with this too. Yeah, you know, I kind of see it, but when I hear a friend tell me, man, I wouldn't wish this on my worst enemy. And if I knew how bad it was, I would have got the vaccine. When I heard that, my next response was, I'm getting the vaccine. But that's just by talking to people and seeing what people think. But to me, it's like when you talk to people of non-color, it's like, you know, I'm like, where's your mask? What are you doing? And it's like, it's no big deal. But, you know, it all came down from politics, you know, and what your president might was saying, and then listening to all the doctors get up front and be confused and flip-flopping back and forth. Yeah, I think people of color are going to be kind of like, get your act together and let me know, you know. But, you know, when it hits home, you know somebody, you talk to somebody who it's like a wake-up call. You know, I talked to a friend yesterday about it, and he's reluctant to taking it because, you know, he was like, oh, cancer is worse than this, you know. And I'm like, yeah, cancer is bad, you know, but this is like a pandemic. Well, yeah, so I couldn't convince him to get it, but, you know, he's like, well, they don't have a cure for cancer. I doubt they have a cure for this too. So I think it's an uphill battle. I think not everyone's going to do it, but I do understand people's reluctancy based on how we've been living over the last 200 so years in this country. And I can't blame people, but I do know it's a very serious thing because it hit home.
Yeah, I can relate to that. And I think when I talk to people, and I have friends who I've had this conversation with, the first thing I think of is one, just respecting their position, and there's a lot of fear out there, which I acknowledge. The vaccines, some of the approaches are pretty new with how the vaccines work. There's a lot of grounded science around it, but there's a lot of trepidation as well. I think, like Swain had mentioned, a lot of history around this issue, though. There's a deep, deep mistrust of medicine amongst many of our communities that in a lot of cases is well founded, whether it's Tuskegee or you go further back to slave history and how slaves used to be sold into experimentation in the South. And a lot of those stories are still told, and that's the reality of a lot of our communities. I think a big part of what we in the health system need to do is own that and acknowledge it. And I think take that in context as we're having conversations to educate people about the importance. And like John, I have known people, I have family, friends who've been impacted by COVID-19, but I've also seen literally how this has affected people in the hospital. And our people were disproportionately impacted, more likely to be admitted and more likely to face mortality. And those aren't fake numbers, they're real statistics. And I think being able to have those conversations to really reinforce how important this is. And I won't push my beliefs on anyone, but at least have the information and be informed so you know how you can protect yourself, your loved ones, your family, and your community.
I think, Swain, you wanted to say something?
And I'm glad I went right after that, because this is about information. I think Errol Parker said this in the previous hour about not being pushy about getting the vaccine, but if you have an opportunity to share the experience, respect someone's reason for not getting it. But we're not here to talk about mRNA, but I want to share something that I share with my patients. There are two things. The CDC has a VIS, or vaccine information sheet, for everything. And now usually it's like a page front and back, because people are not trying to take 2 and 3 pieces of paper away. But because this is the emergency approved vaccine, the Pfizer ones are like 6 pages. The Moderna one is like 5.5. And it is worth the read, because I read mine 2 weeks before I got mine. I read it right before Christmas and ended up getting my first vaccine on New Year's Eve. And so basically, if people want to read the vaccine information sheet and say, okay, I've read this and I still don't want to get it, then fine. As long as they're not reading stuff from social and that they're getting microchips inside of them. But I'm going to give you a stat and then I'm done. My best friend from med school, you'll see him, his name is Muntu Davis. He works down the hall from Dr. Barbara Ferrer. I was in his wedding, he was in my wedding. I love him like a brother. I was on a panel with him, and he had Dr. Arlene Brown, and I can't show you the slides because they're proprietary. I'm going to give you one stat. For every million COVID-19 vaccinations, there are a handful of serious reactions, and there are deaths that are often under investigation that often are discovered unrelated to the vaccine. But for every 1 million COVID-19 cases, there are 70,000 hospitalizations and there are 15,000 deaths. And so I present that to my patients of all races, creeds, colors, ages, religions, and I say, take that information, read the vaccine information sheet, and sometimes I say, call my nurse. When you're ready to get the appointment, you call us, because we help people break the barrier. I called, I couldn't get the appointment, but just have the facts and then let people make a decision.
Well, that's because you all are like in the medical field. My approach is a little different. So my experience with COVID is, like a real good friend of mine came to my wedding, and at the age of 36 succumbed to COVID. So this entire year, I've been actually like in this space with COVID. Like, let me actually reflect on my own experiences and really like dig deep. Black man, we're both West Indian, so a lot of the same similar heritage, upbringing. So this was very real for me. But then I also had to reflect on the fact that I'm a vet. Like, I've had every single vaccine America can stick in me. And on top of that, I went to public school. So I am by no means immune to any, at this point, I think I could drink lead, right? Because of everything that up until this point, they've stuck in me. And I think a lot of times in this experience in COVID and knowing where I'm at. So I'm fully vaccinated, right? That was a choice that I decided to make. But what I also decided to do was, as not necessarily talking about the vaccine, but really digging deeper and asking people like, yo, do you have any underlying, like how's your health? Like, how's your kidneys? How's your heart? How's your organs? Like, what's going on? Because what I realized with this was that we can sit down and pump a vaccine, but there's a lot of people that's 30 that got high blood pressure. And I'm like, how? And I'm saying that in my head, not to them, because there's definitely ways in which how it can happen, but I'm just shocked, like, whoa. So before we pump one thing, we gotta address, like, you know what I mean? And some people are hesitant, yes, because of the trials that have been done on Black folks and Black people in America, but they have very real fears. Like, well, if I get this, will my heart stop? If I get this, will I need a urine bag? Like, what's going to be next? And I think like that's something that, to you all's point, if they read up on it, yes. But also, I think if people also look at the situation from that standpoint, it'll be a little bit more receptive versus just get this because if you don't, you'll die. When it's like, you know what it's like to be Black in America? Like, you know what I mean? Like, so it's really like being real about it with them.
So the one thing, now this is, when I say this is real good conversation, it's because it's, I almost said 9:54. Remember, I'm in Chicago, but it's 7:54 there. But we're supposed to end at 7:55.
Dr. Smith, I think there's like one other question. If we don't mind, I think this is our community. I think Dr. Anderson has something. We can go over just a little bit.
I just want, that's Dr. Johnson. If she said we can go over, we can go over. Go ahead, Doctor.
Just a little bit. But I want to let Dr. Anderson speak. And then I think there was a question in the chat that I want you to raise. Okay.
Yes.
I'll keep it short. I think if we take COVID-19 off the table, underlying conditions within the Black community are an issue. Just across the board. It's been an issue. It was an issue. A lot of it is rooted in poverty, access, inequitable treatment, people just not showing up in ways that they need to. So I think that as we just evaluate that fact alone, there's a lot of generational trauma. Somebody told my grandma this, my grandfather, they gave them this thing and this was the outcome. Then we add on another layer where there's a lot of misinformation as it relates to COVID-19. And it's like, people don't know how to move. I'm partially vaxxed, but conflicted because I understand the emotions associated with that generational trauma while still being able to understand that I need to move in this direction because this is what's long-term, at least from what I know, gonna be better for my health. So I think that like we have to be able to create spaces like in these systems to be able to acknowledge that. And unfortunately, where I see us going is sort of a culture where it's a shaming of those who don't have access. One of the things that I realized when I decided to get vaxxed, and 20 minutes later, I had an appointment to get it. Like I had to own my privilege that I could do that. And I had options. So as we sort of navigate this and we're thinking about what this looks like, I think that we have to be able to look at those other elements. Am I not going to get it because I have a heart condition? Am I not going to get it just because I'm scared and I don't know what's going to happen? Like, how is this all going to work for me? And I think that unfortunately for us, it's always a deeper conversation. It isn't just get it or not get it.
And Dr. Johnson said we had a little more time. I'm back, so that means 10 more minutes. So with that being said, I'm just saying I'm keeping it there because it's our little conversation. But if there are any additional comments or any other things that you would like to say, and then I will ask the question. We've kind of addressed it, but I'll go ahead and put the question out there. And the question says, can we put as much effort in discussing the diseases that were killing Black people before COVID-19? For example, some of the comorbidities, diabetes, obesity, violence. Could we discuss that? What are your thoughts?
I'll go. That's the job of clinicians and people like me. And we actually during this pandemic, there are about, I've now officially have a group text with everybody who has any drop of Black blood in my medical center. And we are all have access to the equity and inclusion and diversity group, and we are focusing, we have a woman who focuses on Black maternal health and diabetes and blood pressure. We have an affiliation with the medical school, and I think that begins with the people that have access to the people that will be able to promote care to us. So I will stand here or sit here right now and say that I take partial responsibility for that, but I'm going to get other people involved that don't look like us to raise the bar for the entire community.
Yeah, I tell you, when I'm a PK, so I think most of you know what PK is. We at our churches, and Earl Parker talked about this a little bit. He has a big, he knows a lot of pastors and a lot of churches. It's important to allow our people to know that there can be access. And in Camden, when we came from Camden, they used to have this mobile truck that does health checks and things, and that truck will come by maybe 2 or 3 times a year and do 500 or 600 people in the church, if the church is that big. Those things are welcome. And I think if we get more involved in our community, flyers, barbershops and hair salons, we know how to get this done. It's just that we do need the helps, Mr. Swain and all you doctors in here, you guys look sharp with these ties on. If we can get that link and get those things done, that's a start, that's a start. And that's what worked, when I was at that one church, but I'm sure it can work in all the churches in Long Beach.
Anyone else?
Yeah, I think it's definitely about some of these underlying, we know there's disparities, I think in every single sense in a lot of different areas, high blood pressure, cancer, stroke, you name it, there's great disparities. I think it's getting further into those social determinants of health. We've talked about them before. We've talked about access. We've talked about housing, education, transportation. A lot of those things show up in our health outcomes, and our systems are inherently inequitable. And I think to Navon's point, I think one of the single most ways to impact and affect that change, as I talked about the individual, community, and systemic level, it's at the systemic level. And I think a closing thought from my vantage point is I think we as Black people have a very narrow window. We have the attention, we have the empathy, we have the compassion from a lot of our other brothers and sisters. And so I think we need to enroll allies. We need to be about using our voice to persuade change in legislation, advocacy, being able to influence change at the management level in boardrooms. We can all say that we've seen these issues and inequities for some time, but I think we need to realize the unique opportunity we have in front of us to actually influence and impact change.
Well, I mean, what can I say? When the COVID-19 is over, I'm flying out to Long Beach and we're gonna hang out, right? So I'm coming out to Long Beach. Y'all cool in California. I'm just saying. And one thing, I'm going to defer to Dr. Johnson, who coordinated this, but we did good because the NFL draft is going on and we stayed focused. So I'm just saying, we stayed focused. I'm sure nobody went to the NFL site and clicked and see who people selected because we were focused. I did it before, but I'm not gonna worry about it. But the Bears got somebody good. So I'm just saying, I'm a Bears fan. I'm putting it out there. I'm a Bears fan. Don't give my blood pressure up.
Very good.
That's what I'm a little happy. I'm a little happy.
Somebody.
Hey,
I'm just got a kicker.
Well, you can't have everything. So I'm going to defer to Dr. Johnson. And Dr. Johnson, is there anything you would like to say before we depart? But it looks like we may have to do this again.
I just want to give a huge hand clap for you, Dr. Smith. You moderated this session. So, it was awesome. And, I asked you and you heeded the call, and I am so grateful for you. Thank you. You really made this interactive, and I couldn't have asked you to done it any better. So, thank you. And thank you all to our panelists. I mean, I hate to even come behind that, because I just wanted to amplify Black male voices. A lot of times Black women are on panels, Black women are at the seat, but you all are doing work too. And I wanted to take the time to amplify your voice, your message. You, as you know, you come from so many different ages, so many different backgrounds. And I think that's important, that we should reflect difference of opinion, approaches, and so forth. If I were to wrap everything up, is, it is so important for us to be educated, not just be educated on the COVID-19 vaccine or COVID, but understand the systems that create disproportionate health outcomes for Black people. We didn't get a chance to name it, but what we're really dealing with, with health disparities and inequities, is institutional racism. And I think it's important that we name it, and because we can't address something until we fully name what it is. And what we're talking about is we have to address the institutional racism that has plagued this country, and made it so that we are disproportionately affected by COVID-19. So long before COVID-19, long after COVID-19 will be a nightmare in our historical lives, we still have to deal with the structures that create the inequities for Black people, leading to health disparities. And I hope that you understand that these town halls are a way of engaging the community, creating space for culturally tailored space where people can authentically engage and talk, learn about what's going on in the community. And I want to continue to thank you for always being here and continue to be a part of the conversation, and know it's just a conversation, and that there are things going on behind the scenes that that speak to the fact that we understand that it is a systemic institutional racism that is contributing, and not just with health, but we're talking about education, employment, healthcare access. All of those things are creating and contributing to long sustained inequities that's leading to health disparities. And we intend to continue to talk about it, advocate for it, and do something about it. So again, I just want to share a few things. We are on social media. If you want to follow our journey, if you can see, please follow us at Black Health Equity LB. Thank you for those that have followed us thus far. In addition to, we are currently planning a health education event where there are going to be opportunities to get healthcare screenings. And if you so inclined want to get the vaccine, you will be able to do that as well. And so please look out for more information about that. But just a thank you again to our town hall participants. Thank you very much. My college, Health and Human Services, and our Dean, Monica Lounsbury, Sharon Cruz, Tony Chacon, Memorial Long Beach Medical Center, Memorials Children and Women's Hospital, Kelly Collins, in the city of Long Beach. So with that, I bid you all adieu. And thank you, thank you, thank you. I really appreciate you all being here. And I will see you at the next town hall.